Informed consent is a straightforward medical legal principle and requires 4 separate conditions to be met. First, there must be a discussion of pertinent information with the patient, even in the situation where there is a language barrier and a medical interpreter is needed. This is the physician's responsibility to make sure this step occurs. Next, the patient must be understanding of the plan of care, which means they have the ability to comprehend what is going on. The patient must have capacity to make their own decisions. And lastly, the patient must be free from coercion, and thus they are acting voluntarily. Essentially, informed consent requires that the patient understand the risks, benefits, and alternatives of the decision, which includes no intervention. Patients must also be informed that they have the right at any time during this process to revoke any written consent. This does include oral revoking of written consent. There are exceptions to consent, and on the exam, exceptions to informed consent are more likely to be tested than informed consent itself. A great way to remember these exceptions is with the mnemonic, wipe it away. W stands for waiver. Here, the patient explicitly waives the right for informed consent. This is seen rarely at best, but would be a situation where the patient does not wish to know what's going on in their care, but still wishes to be treated. I stands for legally incompetent. If a patient lacks decision-making capacity or is legally incompetent, then there is no requirement for informed consent. Here, your goal should be to obtain consent from the legal surrogate. P stands for therapeutic privilege, which is when the provider withholds information when full disclosure would severely harm the patient or undermine informed decision-making capacity. An example may be a depressed, suicidal patient who has a new diagnosis of terminal cancer. Since this is a controversial topic in clinical practice, however, you can be pretty confident that invoking therapeutic privilege on the boards will likely be the wrong answer. And E stands for emergency situations. Implied consent is almost always the case in an emergency situation. Informed consent can show up in disguise on the boards. For example, when a blunt force trauma patient comes into the ER, a question may ask you the next step. Go to the OR or resuscitate the patient and obtain informed consent. This is important because the question is actually asking you if the presentation is emergent. Because this presentation is emergent, thus consent would be implied. Thanks for watching, and be sure to click thumbs up if you enjoyed this video.